Good morning, everyone. We'll give it just a second as we let people in, but thank you all for joining us for today, September 25th, 2024's V3 implementation call. Always takes a minute as I watch everyone sort of connect to audio, but as you join, if you don't mind updating your organization affiliation in your name in the Zoom chat, that will help us with attendance. And as always, please feel free to type questions or comments into the chat. We'll unmute folks as needed, or please raise your hand if you'd like to come off mute. And with that, I will kind of move down and we'll kind of go straight to the agenda. I'm actually going to fill in for John this morning, but uh, otherwise, the agenda will remain the same. And then today we've got the fourth week state receive and process vendor breakout at the end of this call. If you have questions about what room to go to, we'll talk about that here at the end of the call. But with that, Bengie, do you want to do stakeholder introductions?
Yes, thanks, Ben. Just need to screen share. Okay, good morning, everyone. Are you seeing my screen is okay? We're good.
Yep.
All right, thanks. All right, good morning, everyone. Today I'll be filling in for John for the stakeholder introductions. The purpose of the introduction is for us to get to know each other really well and for other people who we may not know on the call. It's also to build connections with stakeholders and just to get an idea of what your hobbies are. So when we meet in person for the annual meeting, we can have something to chat about. The first person we're going to introduce today, they like to garden, kayak, and hang out with their family to unwind or relax. An interesting fact about them is that they learned American Sign Language and signed exact English language when they worked with deaf students. Something we may not know about this person is that they worked as a can and preschool teacher. And when we asked how long they've been in the EMS or healthcare field, they said just a few weeks. So this person is a newbie. When we asked, what do you like best about your job? They answered that they've always been drawn to medical services and patient care, and they like having the opportunity to work behind the scenes in EMS data as a new and exciting experience, and that it allows them to devote time and energy towards patient care in a unique and impactful way. Any guesses of who this person might be? You can put it in the chat or you can come off mute. I think if Chris would allow it, to pick your guest. Any idea who this person might be? Hey, no worries. It's our new administrative assistant, Miss Misha Gurdikin. She is a new member of the NEMSIS TAC. She will be our new administrative assistant, backfilling my previous position. Misha, I think you're here. Would you like to come off mute and just say hello?
Hey everybody.
Do you have anything else you want to share? No. Okay.
I wasn't a can though, I was a CNA. I apologize for that.
Oh, CNA. Okay.
Yeah.
Thank you for correcting us. So she worked as a CNA, not Ken. I was wondering what that was. All right. Thanks, Misha. You'll get to meet everyone else on the call in our annual meeting. Our next introduction for the next person, the person likes to hike, yoga, run, read, and they like to play with their pup Ruth. An interesting fact about this person is that they worked in retail at the mall. Something we may not know is that they worked as a veterinary medicine before switching over to human medicine because they really love animals. And when we asked how long have you been working with EMS data or healthcare data, they said over 10 years. When we asked what they like most about their job, they said it's really interesting information that has a positive impact on others. Does anyone have any guess on who this person might be? Any guesses? Not even one. That's okay, because you'll also meet this person at our annual meeting. It's our new BDA, our business data analyst, Amanda Pope. She's our newest BDA, our business data analyst. And Amanda, if you're on the call, would you like to come off mute and say hi? I maybe.
Hi, everybody. Nice to meet you.
All right, Amanda, anything else you want to share with us? No. Okay. Thank you, Amanda. Thank you, Misha, and everyone else. You'll get to meet them at the annual meeting. Thanks. Turning it over to you, Ben.
Great, thank you. All right, so let's see here. Moving down the agenda, it looks like we were scheduled to do a dashboard review with John this morning, but we will reschedule that for another time. But if you do notice anything on the V3 map contact information on the NEMSIS main webpage is incorrect, please open a help desk ticket and we will get that updated. Again, that's the big map on our main webpage. When you click on a state, there will be contact information for the state offices of EMS. So please just let us know if any of that needs to be updated. And with that, I will actually hand it over to Monet for the monthly report update.
Thanks, Ben. Greetings, everyone. Yes, you are able to see my screen. Thank you so much for being on the call today. The first thing I'm going to go over is the monthly report. And the way you would find that report is go to View Reports, Public Reports, and then the NEMSIS monthly reports. And so we missed a call earlier this month, and I didn't have an opportunity to talk about the August report, but it is currently on the website. And in a few days, we will have the September report available. So this report is a high-level overview of various things, activities that the NEMSIS TAC team is involved in. And if you ever, let's say, for instance, you took a vacation for a couple of weeks and you wanted to just kind of get a high-level overview of various things that the NEMSIS TAC is engaged in, you could simply go to this report. We would have the information about various collaborations, what we're doing with the DMC, which is the Data Managers Council, if you're not familiar with that term. We also have some updates about the annual meeting. There are the links to the previous V3 implementation calls, as well as the public training. Several other presentations that were provided during the month. And then there's also some updates about things that are happening on the website. You want to know who's recently tested for compliance. That information is available here. And so we do like to provide this report consistently each month. We like to have input from various stakeholders about anything that might be missing from this report. So if you have any questions about this report, please don't hesitate to reach out to us, and we will be sure to answer those questions. All right, are there any questions about this report at this time? Fantastic. All right, the next thing I'm going to go to is the NEMSIS annual meeting. And the way we can get to that one quickly is to click on the home logo up here at the top. You should see this banner that says NEMSIS annual meeting. Let's click on that. And then we're going to first talk about the agenda. So we currently have an updated agenda on the website. It's still stamped as draft because we do intend to fill in a few gaps with some additional topics, but you do have a little bit more of an overview of what's happening each day. The other thing I'm going to mention quickly is each night we have an activity plan. So for instance, if you are able to arrive on Monday, we are going to have an event at 7 o'clock, which is a meet and greet over s'mores and maybe some drinks. And this will be at the Hotel Fire Pit. Tuesday, we also have a dinner, which is on your own, and we have an optional activity. And so the optional activities will be taking place Tuesday through Thursday. And so I want to provide a little bit more information about that, but please take a look at this agenda. We will provide another update as we get closer to the meeting, but many of you have been waiting for this updated agenda, so please take a look at it. The other thing I want to mention is the activities. So I'm going to go ahead and open up this document. So what we've decided to do, we have well over 150 people currently registered, and we will have some transportation available, but we would like for the in-person participants to choose two options. You're going to first choose your favorite option, and then you're going to choose an alternate option. And the three options are the Homestead Crater, which is a geothermal spring, which is located a few miles from the Park City area. We will have a transportation available for commute to this location. There is more information in this link here, but this is one of the options that you could choose. And this will be available on both Tuesday and Wednesday. The second one, so many of you wanted to play pickleball last year, but we were not able to do pickleball due to the gym needed a reconstruction on the floor. So now that that work is complete, we will do pickleball as well as basketball. So if you're that really athletic person or just someone who really enjoys, competitive sport, please sign up for the pickleball and basketball option. And then the third option is the strolling on Main Street. And then you'll have an opportunity to stop at the Java Joe ice cream parlor and get a sweet treat. Now, in addition to these options, we will still have our scavenger hunt. We have a pool party that's scheduled for everyone to attend. But these are just optional activities that you can participate in. If you choose to do the pickleball, there is a waiver that you need to complete, and we'll go ahead and drop these in the chat for you. And also what we'll do is we'll drop this link here so that you can choose your options. We'll need to go ahead and have you select those. And we would like for you to complete this by October the 4th. So are there any questions at this time? All right, you know all the ways to get in contact with us. So if you have any questions, please don't hesitate to reach out. If you have any questions about anything related to the annual meeting, just let us know. And one additional thing I will mention, we will be closing this registration portal on Monday, October the 7th. That information is listed here. Yes, it's right here. Monday, October the 7th, the registration portal will close. So we need you to go ahead and get your registration taken care of before that date. The other thing I will mention is that at the Sheraton Hotel, the NEMSIS block is currently sold out. However, there are still rooms available. So if you don't find the room, data range of rooms that you need for on the website, go ahead and give them a call because they are definitely willing to help out the NEMSIS stakeholders. And so if you are able to get in at the Sheraton, that'll be great. If for some reason you cannot get into the Sheraton, go ahead and give the folks at the DoubleTree a call. They're also aware that we're having our annual meeting, and they have provided some rooms as well at a good rate. So I think we have covered many of the issues related or topics related to the annual meeting. But if you have questions, please let us know. And now, Ben, I'm going to turn it over to you, back to you, because I think Dr. Mann, if he's on the call, he wants to talk a little bit about the agenda. Thanks, everyone. Look forward to seeing you soon.
Thanks, Monet. Yeah, I think Clay had hoped to get some feedback about potential discussion topics for the annual meeting. He is at the NESMSA regional meeting or traveling back from a NESMSA regional meeting, and so I don't know that he is going to be able to join us. What I will say is, I think if anyone has um, feedback or topics for the annual meeting pre-conference, please reach out to the TAC with those topics, and then we may solicit some more feedback through other means here, just because I know he was not able to join the meeting this morning. Um, um, So with that, we'll actually move ahead to Randall. I think you were going to present on using NEMSIS data to address older adult falls.
Uh,
Uh,
that is that is correct, Ben. Can you hear me okay?
yep, sounds good.
Perfect. I'm going to share my screen as well. We have a short little PowerPoint here. That's looking good there.
Yep, we
All
see a
right.
barcode.
So there's a QR code there. So as we kind of go through this, if anyone would like to, you can take a picture of that. Hopefully it will work. It'll take you to the nacho.org website. That will be an area where you'll be able to find this resource. So as I kind of give everyone a moment to sort of look for that, this guy really was from the National Association of County and City Health Officials, or NACHO, in collaboration with the National Association of State EMS Officials, well, with funding from the CDC, we're really pleased to announce this new publication guide using the NEMSIS data to address older falls at the local level. This guide provides an introduction to the local health departments interested in accessing emergency medical service data to address older adult fall prevention within their communities. This guide describes the characteristics of the data that may be available to evaluate the prevalence of older adult falls occurring within their jurisdiction and to monitor data trends over time for the evaluation process. So this was just a quick project that we did here with NACHO, which is the National Association of City and County Health Officials. So kind of starting off here with this first slide, leveraging NEMSIS data for local health efforts. We kind of just had some different topics here. And here it was really focusing on how NEMSIS data can inform the development of programs in reducing the incidence of falls and mitigating their impact. This next slide here is we kind of have some accessing the NEMSIS data with some of the sample older adult fall data points. So here we try to break down some of the data elements from the data dictionary just to kind of help give some guidance. A lot of these are just words or numbers to a lot of folks. So this really kind of helped break it down. So as they're reaching out to do the research, they have some kind of guidance to help them. This next portion of this guy was just like a standard 911 call from the time that, the fall actually happens to the moment that it's dispatched, to the ambulance response, that the crews are providing care on scene and they're transporting. And during this entire time, they're actually collecting many of these data points out there. So besides providing the care, they're also starting to see that they are collecting all of this great data with us as well. You'll also see that there's a summary here of that same portion of before. And we also kind of got into a little bit of the dissemination. What should we do with this data? How can we use it for each other? And we gave some tips of making sure that, we're using data use agreements, working with our local organizations, or if we have multiple EMS agencies in the same jurisdiction, making sure that we're able to, go to that state level to see if we can find additional information or to help line those data points up between the different EMS crews. So really, as a result of the data being uniform across all ambulance services and other EMS agencies, they can be shared and analyzed at the national, state, and local level. This paper really was about the local efforts or the state efforts, but we did definitely include the national level material. And so we really highlighted also with the NEMSIS portion of that, the annual reports that they create, being able to use that national level data to kind of start to develop the problems in your area. So even though this is addressed around older adult ground level falls, you really could kind of insert any other kind of criteria into that to have the same solution. So once again, this is available at the NHTSA.org website. Highly recommend that you all download it, send it off to anybody you can, any of your local health departments, EMS agencies. I know our state data managers and our trauma managers have also gotten a copy to send out. So really, this is just about circulating this effort out and understanding what the NEMSIS data can do for us. Any questions on that?
All right. Thank you very much, Randall. Looks like Bengie posted links in the chat as well. Yeah, that's great work.
Thank you.
All right. Looks like for the next two topics, we're going to head over to Jen Correa for validation rules discussion and some information about the candidate release.
Good morning, everyone. So I hope I am sharing my screen successfully this time. The first thing that we're going to talk about is a validation rule. And if you'll remember, we put out the request and said anytime an agency or has a question about a state or national schematron rule, or a state has a question about a national schematron rule, right? So any type of validation schematron rule you want to talk about on the B3 call, please submit it and kind of give us an idea of where the questions are, or where the interest is in revising, or where the discussion should go, so that we can all talk about it together. So I'm hoping that I'll see some hands raised or some folks come off mute and make this a discussion. So this one was actually brought by an EMS state office. Both the data manager and the director contacted us, and they wanted to talk a little bit about the national schematron warning around the patient transfer of care date time, which is E times 12. The rule that they were specifically asking about is when disposition 30, transport disposition, says transport by this EMS unit, they get a warning on the national level that says you must have a time, right? Or you're going to get a warning. And their kind of their reasoning behind this is that in their state, when the patient is taken to home or a dialysis center or a skilled nursing facility, the time that the patient care was transferred is not significant within their environment, and that they would like to not have a warning. It's great if they can get it, but they don't want to have that warning show up. And because it's a national schematron rule, they do see that warning. So they wanted to bring it up and have everyone talk about it, see what other states think, see what the agencies think, whether they believe that this is unnecessary documentation. Their suggestion was to have the national schematron rule revised so that it's only looking at when the destination type is a hospital, freestanding ED facility as a destination type. So what are your thoughts out there? And if I hear no thoughts, I'll think they're all by themselves out there alone on this. And I have a feeling that's not true. So is there anybody who wants to raise their hand, be the first to speak? Keeping an eye on the chat.
And you should be able to unmute yourself if you'd like to speak.
Chad, did I see you come off mute on?
I did. I can never figure out how to raise my hand, but I was going to wait and see if somebody else spoke up first, but nobody was.
You go for it.
Yeah, no, I'm torn a little bit on that. I 100% understand the piece of if they're taking a patient back home. I think in that capacity, there's really no one that they're transferring care to unless they're transferring it right back to the patient themselves. So I can see there being situations for sure where this is not applicable. But at the same time, I think there are places that are outside of just a hospital or freestanding ED where it is applicable. I think anytime that they're transferring the care of that patient to somebody else should be documented. So if they're taking them back to a nursing home, if they're taking them to a dialysis center, if there's a transfer going on with the nurse at the dialysis center, I would say then that needs to be documented. If they're not, and they're just rolling up to the dialysis center and dropping them off at the door, then that makes sense. So I think if there was a way, I don't know how we would be able to do that, but if there's a true transfer of care of that patient from the EMS crew to some other medical professional, then I think that's when it definitely needs to be applicable. And then if there's not, then it absolutely shouldn't necessarily have to be filled out.
So do you think that beyond the hospitals and the freestanding EDs, that would be something the states and or agencies should apply rules to? Or do you like that the national rule puts out the warning, which can then be said, oh no, I didn't mean to have one in there, right? Because it's only a warning, it'll still transmit. How do you feel about that? Do you think the states and agencies would do that?
Yeah, I mean, I think that I think absolutely at the national level, it should be for sure hospitals and freestanding EDs, because that seems to be where a lot of the data gets ran from on research nationally, is patients being taken to hospitals. I think if you look at that piece of it, there would be the argument too of, well, okay, are we only talking about 911 calls then? But I think anytime a hospital or freestanding ED, so that definitely should be a national rule and warning, in my opinion, on it. But I think I was trying to pull up my NEMSIS stuff here, but I almost wonder if it's not just if it's a medical facility type thing, that it's part of the national rule, and then anywhere else would be the state one. So you're talking hospital ED, hospital non-ED, it's like an assisted living facility. They're not being transferred back to anybody. So maybe that is a good way to go, is just if it's a hospital or freestanding EDs, then it's a national rule. And if you want to add more as a state, you can absolutely do that. I'd be fine with that.
Thank you, Chad. And I want to read a couple of the chats. Caitlin from Angel Track, we auto set the time of transfer of care to be the time that the transfer signature was collected. So that, once you get that signature, that's the time that care was transferred. And I know there's a couple other softwares that do that as well. So that's another way to look at it. Brooke Burton said individual agencies can set this as a validation rule if it is applicable to them. And David Saylor, if it's home, there is not applicable value as well that can be selected by the EMS clinicians. So those are all really good points. Is there anyone else who wants to
Jen, can I say something on one of those? Sorry, I want to jump in on that. I don't disagree with David. David knows I love him to death. But I don't disagree with him on that. But the reality is, we should not and cannot, in my opinion, expect EMS providers to click not applicable on every element that has not values available where it's not applicable. Like that's one of the things we try to avoid, just because in my mind that truly does add work to the EMS providers if they're having to say, okay, well, this is not applicable, let's click it, as opposed to it just not being a rule that they can bypass and move on from. And I do like it that David can't unmute and respond to me on that, so that'll help.
Oh, but he can type, my friend. He can type. So are there
well, don't worry, Chad. I'm here. I got his back.
And then Brooke said she agreed with Chad. Macrologic, Steve from Macrologic said we do the same autofill when the signature is created. So it sounds like everybody would be open to some discussions about adjusting the national rule around the E times 12. Are there any arguments for keeping it the same? And again, I just want to remind everybody, if you're uncomfortable, and I would hope you are not, and I hope you get comfortable. If you're uncomfortable speaking up on the B3 implementation calls, please feel free to send in a help desk ticket or email to me your opinions or thoughts. We do want to hear from everybody. National rules sometimes need revising as well. So we will take these. So there's been 5 rules that we have talked about over this past year. I'm going to write those up and I'll present those at the next one and let you know what the overall thoughts were and maybe get some discussion started on how to revise. So I am also the next topic, which will probably be pretty exciting for everyone. Version 351. All right. We were able to do the candidate release, and just really briefly, I will say the candidate release, some of you know that as a beta testing. This is the opportunity for the vendors to take and shake and break and do whatever they can with the resources and the information available. They can start their development, and then they get back to us and let us know if they find any issues that need to be addressed or they have questions. This is also an opportunity for the folks out there, the agencies and the states, to start looking and seeing what's included in version 351. And as a way to help facilitate that, we have put out quite a few resources and made those available. Some folks really like to get their information from the Git repo. So I'm going to show you really quickly how to get to the Git repo. If you happen to go here, you don't have it linked somehow. Under technical resources, resource repository, just click there. It's going to go. There's a guide here. If you have any questions about what's included in each of the folders within the resource repository, you'll see here our partner repository, which is also new this year with the CARES information being there. And then you have the NEMSIS V3 resource repository, which is where all of our information is. And in the NEMSIS public repository, click on that, and you'll see here source. Please make sure if you're going here that you change the source to 351. That's really important. Otherwise, the documents that you get out of the Git repository will not be 351. They will be 350 or some other version. So that's the easy way to get over to the Git repo. And let's say you're like, oh gosh, I don't want to go through the Git repo. I just want to be able to pull stuff. All of the links to the resources. Anne, I saw you had your hand up, hon. You should be able to unmute.
Try now, Anne.
Ben muted me. Just kidding. I tried to unmute before for the discussion and then I couldn't, and then I think I could. So sorry. All right. I have a question and I think I know the answer, or I should by now. With this being the candidate release, does that mean that as a state, if I go in there and look at so I started looking at the change log yesterday, and thank you for the resources because don't know what I'd do without them. Can we count on that being the 351 version? I know you said the vendors are going to test things and see if there's issues, but I just want to confirm that's not going to really affect if we're updating a data dictionary or anything like that, as far as our side, or will it? Should we hold off?
It should not. So this, and the nice part about this being a minor release is that the changes aren't major, like we had those disposition changes with version 3.4 to 3.5. With 3.5.1 being a minor release, the only thing the vendor should come up with is we might have something set to 0 to 1 and our data dictionary says 0 to many, or vice versa. Things that are just little things to fix. You should be able to, and I say should, so you should be able to count on the changes that are in there being present in version 3.5.1 in the final release. If something major does come up and somebody brings something to our attention, we would let you know before the final release in January of 2025. So, and Anne brings up a good point. We've got resources for you. So for the data dictionary and the XSD information for version 3.5.1, you go under the technical resources, data dictionaries, and XSD page, and you'll notice that there is now at the top of the page a section for the NEMSIS version 3.5.1. 240923 is the official long, right? We just say 3.5.1. Candidate release 1. You've got your web version, your PDF version. Please be careful. We had a few questions that came in. Somebody downloaded on accident the national elements only data dictionary for V3.5 and then couldn't find some elements they were looking for that were not national. So make sure if you download that you're downloading the full, or you label that it's a national elements only data dictionary. The extended data definitions are provided by NEMSIS, and then your V3.5.1 change log. So these are all available. I will also available is a slideshow. I'm sorry, I meant to go over here. Up here at the top of the page, you can click over to the list of resources, which will take you directly to this page. Or you can always use your using EMS data, V35 revisions, list of V35 resources, and you'll end up at the same page. So that from there is just a shortcut. And at the top of the page, you'll see all of your resources that you can start taking a look at. New this year with this release is a slideshow of changes and a companion list that goes with that slideshow. So the companion list simply has the slide number, little note about the change and what element it is, and if it's a new element, what the new element title is. And we did that so that as you're going through this 200 slide change, you can just get to what you would like to get. They are in descending order, right? So D agency 07, there was an update in the link. You can see it, and you'll notice that we pulled our screenshots from the highlighted data dictionary, which is also available as a resource on the website. That highlight just shows you where the change is, just to bring it more to your attention as you're going through it. We also have the 2 items that were used, and we got quite a few compliments on them with version 350, is the elements comparison summary and the value comparison summary, which are also available. The element summary looks very, very familiar. It is exactly the same setup that was created for version 3.4 to 3.5. It's just now 3.50 to 3.51. If you want to look at the changes, new elements, if you want to look at just the EMS data set, DEM data set, state data set, national, right? So I think many of you have used these before. And then there is also the value comparison. And again, we set it up exactly how the 3.4 to 3.5, no changes in the style or anything like that. All of the elements, we've got the highlights, what's new, if there's a new pattern. And if you just want to see the list of new values, that's the new descriptions, then you can go in here and it'll show you what new values are there, whether it's a new element or whether it was just something that was added within that value in that element itself. So right, David, it is so large, it was better to put it in as the Google Slides and not PowerPoint, which once you save it, you can save it to PowerPoint to your desktop. But that way it downloaded, it opened quickly. There were fewer issues by making it the Google Slides.
I just mean the page says PowerPoint, that it's a PowerPoint presentation. Just tiny nitpicky thing.
Yep. Okay. So I'll take that back to the team and we'll see if we need to relabel that or not. Were there any questions or any thoughts, or is there another resource that you would like to maybe have us discuss developing for a 3.51 version release in January?
I like that, but I brought it up in the chat, but on the data dictionary page, I actually just ran into this where we were looking up the E12's definition.
On this page here?
Can you? Yes, can you hear me?
I can hear you now, but I think I lost you somewhere
Okay.
in the middle.
Okay, yeah, my computer's complaining. So yeah, I went to here to find the E times 12 definition, and the first result, the first set of data dictionaries is this beta version. I thought that seemed a little bit off, that somebody wanting to look up something right now today should go to 3.50 first and not 3.51.
We'll see what we can do to kind of differentiate that a little more clearly and make it clear which version is which, associated with which materials.
Yep.
Okay, so I started to look through the chat and make sure I hadn't missed anything else. Sorry about that, David. Were there any other thoughts or comments or ideas? Fantastic. All right, I'm going to turn it back to you, Ben. Thank you.
All right. We actually have a guest presenter for the next bit. So Gavin Sussman from the Texas Office of EMS is going to talk about a crash linkage pilot project. So Gavin, you should be able to share your screen and unmute, but let us know if you need anything.
Yes, excellent. Well, Benjamin, thank you so much for that introduction. For those of you who I've not had a chance to meet yet, my name is Gavin Sussman. I'm the manager of the state EMS and trauma registry in Texas. So really happy to be here today talking about some of our crash linkage initiatives. Let me just see if y'all can see my screen.
Yep, there we go.
And are y'all able to see it?
Yes, now we can.
Excellent. So we actually are working on a pilot study in the Texas Panhandle area. We define our different regions in Texas. We call them regional advisory councils. So this project was in the RAC A and the RAC B area. So we worked with the Texas Department of Public Safety, as well as all the EMS providers within that region. The goal of the project was to find a way to link the crash data with our existing EMS and trauma data. So we can try to have a better data set that includes all the crash information, as well as the patient outcomes. The way that we were able to do this is actually, we did not have to make any custom changes. We were able to use existing NEMSIS elements, which was pretty incredible. One way that we were able to do this is using our state wristband number. So as of a couple of years ago, pretty much every single EMS patient in Texas, they will get a scannable wristband when the EMS crew picks up the patient. This number is scanned by the hospital crew upon the patient's arrival, and it actually goes into our trauma patient care record under the ITDX state trauma number. We record this in NEMSIS using the eOutcome 03 and eOutcome 04, using the other category so that we can use one of the existing data elements. Another benefit to the wristband is it also has triage capabilities. So instead of the crews having to carry triage tags that they're not utilizing, they can instead use the wristband to serve that dual purpose. The kind of complexity of this was getting the wristband information taken by the state Department of Public Safety, because in the crash form that they record on any motor vehicle collision, there's really no field for a patient wristband number. So in the future, that's something that we're hoping to do using this patient wristband number across crash reports, EMS, and trauma. But for this project, we actually used the crash ID number from the Department of Public Safety, and we were able to put that into the same NEMSIS field, the eOutcome 03 and eOutcome 04, and link the information using the Department of Public Safety's crash ID number. This information was exchanged between the troopers and the EMS crews on the scene using a business card most of the time. If they were not able to obtain the crash ID number, we provided the EMS agencies with the number for their local DPS dispatch center, and that way they could obtain the crash ID number after they do the patient transfer. So like I said, just for the purpose of this pilot study, we were using the crash ID number and the Texas wristband number to complete this linkage. But the goal is that in the future, we can use the wristband for all three purposes. So we did develop a couple of guides, really to help our different customers. One was developed with Sancio, who is one of our predominant vendors in the RAC B area. We also worked with TraumaSoft, with ESO Solutions, and then we also made a guide for people that are doing direct entry, explaining how it differs inputting a crash ID number versus a state wristband number. So I know I only have a few minutes here, but definitely happy to open the floor for any questions. I think some major impacts of this project are, one thing we're able to see are the number of patients that are injured in each crash, even if they're being self-transported to the hospital and not going with EMS. We found in this Texas Panhandle region, they were having about 2.4 patients on the scene of each motor vehicle collision, which is definitely different than some of our urban crashes. when it takes, 40 minutes to get the resource to that area. So I'll just kind of pause there. As we work on joining the data together in the next couple of months, I'm sure that we're going to have some more presentations that we can provide. But just want to thank Lori for giving me the opportunity and all of our stakeholders that collaborated, to make this possible.
Gavin, thank you so much. It looks like, hang on, let me turn on mute. Looks like Caitlin Hanka asked about what values you're using in E other O3, and Brooke asks about getting data back to individual providers.
That's a great question. So we are using the eOutcome 03 and eOutcome 04 to record both the state wristband number and the crash ID number. So when they input a Texas wristband number, they're using the other category. When they're inputting a crash ID number from the Department of Public Safety, they're selecting this law enforcement component. The nice thing about the eOutcome 03 and 04 is it's not limited to one response. You guys can actually use this for multiple different values. So there's no restriction if you want to use this for a state trauma number, a state EMS ID number. You can use it for multiple values. As far as an EMS provider getting access to this data, if you're in the pilot study area, definitely reach out to us directly and we can work with you on getting you the outcome information from your submissions. We're going to be working with your local regional advisory councils, RAC A and B, on developing some publications based on the research that was done.
A couple more questions. Anne asks about any info to pass on for buy-in from EMS for using these, the cost of getting the project together. And this is like 5 questions.
So, Anne,
I was trying to be efficient, man, so.
I'm definitely following the points that you made here. So the Texas wristband, this was actually a statewide project, but the RACs actually provide the wristbands to their local EMS providers. So we worked with the RACs in that area. They have monthly meetings with all of their EMS providers that participate in the RAC. And we found that when we explained the value of this project, if we can link the crash information, was the crash caused by speed, intoxication, commercial vehicle involvement, somebody who is unlicensed? I mean, we don't have that level of information in an EMS patient care record. So I think when you explain to them that we can now connect why these people are getting so hurt, why they're in the hospital for 10 days, we can kind of quantify that injury. So we found it was really easy to get their buy-in, understanding it was just one extra field that they have to input. And, going forward, we're hoping that the DPS trooper can just take the wristband number. So it's no manual work that has to be done by the EMS agency. I think the other benefit is this replaces the trauma triage tag per our state EMS guidelines. So rather than having to buy trauma triage tags, they normally just purchase a bulk number of wristbands, and it serves that dual purpose. So Anne, definitely feel free to weigh in if there's anything I didn't address in there, but we did get really good buy-in from the region. We're hoping to do this statewide in the future, but we think really just starting with a targeted area was a good way to show if this was going to be effective.
All right. Thank you so much, Gavin. I think there are still some questions coming into the chat. We'll keep an eye on them and kind of forward them along and make sure people are able to see those. I do want to make sure we have enough time to move through a couple more items. But yeah, thank you so much, Gavin. And we will definitely keep track of all the questions that still come into the chat and see if we can get answers to any of them or see if we can continue that conversation.
That sounds great, Ben. Thank you for having me.
All right. Let's see here. A couple more items. I think Eric is at the same regional meeting that Clay is at. I don't think there are any items from the Office of EMS just right now. Let me just make sure. Yep. So with that, we will turn it over to open forum if anyone has anything they'd like to bring up. And you should be able to raise your hand, type in the chat, or unmute yourself.
I was kind of pondering something related to a proposed change for additional time zones. Do we haven't encountered anybody like this, but do agencies have multiple stations that are in different time zones? And you might know this, Jen, from AMR, but have you had that before?
We have, I know previously we had agencies that respond to multiple time zones. They cross over that hour line, that invisible hour line, but they always use the time zone where their main operation was located. And then they just did everything in that time zone. And made sure that the timestamps showed the correct negative, but I can't even think of what it's called off the top of my head. I'm sorry, but
Offset.
Yeah, offset. Thank you.
Yeah, I was just wondering if if there's any value in having the station, the EMS location, have a time zone fields as it has an address, but if the agency's footprint spans multiple places. But if not, that's fine.
I was trying to look to see if anyone with the states that get affected by this more than others. Tennessee is the one that pops to mind, but Brittany's not on. That'd probably be a good conversation to start with a few of those data managers where it does affect them, because that date timeline goes through their state.
All right. Any other questions about either time zones or anything else? If not, the next V3 call will be October 9th, same time and place. And then the October 23rd call will be canceled because hopefully you'll all be joining us at the annual meeting, followed by one in November. And let's see, with that, I think we're ready to go to breakout groups. Chris, I will let you kick off the breakout rooms.